Thank you, Acting Speaker. Acting Speaker, this is the 29th health budget that I've spoken on now. I wish I could say that I have any confidence that the 59.4 billion rand will be efficiently and effectively spent. Every year, there are the same dreary reports of corruption, irregularities, and wasted spending. For the entire period of this past year, there was an acting head of department and an acting chief financial officer. Only now have these positions been filled, and it remains to be seen what difference it will make. I remember when previous health MECs speculated that the health budget would be adequate if it was properly spent in the key areas. A former CEO of one of the academic hospitals spent time at the department's head office, and then he left for the private health sector. He said to me he couldn't understand how so little was achieved with such a large budget. Now, Amos Masondo was the first health MEC, and he promised more than 20 years ago in this very house to implement a computerized health information system. This system will not only vastly assist patient administration by cutting long queues, it would also tell you where money is best spent to achieve the most impact. Then we had former health MEC Brian Klongwa, who is now facing trial for corruption related to the 1.4 billion rand tender for the health information and electronic health record system, which could have been implemented 12 years ago. Just think about it. We could have had this system implemented 12 years ago. Just imagine the difference this would have made in saving lives and alleviating suffering. Now, after all these years, and I hope it goes well this time round, the department is promising yet again to implement a health information system. I hope they get it right this time, but we will have to see. The assassination of health official Babita Deokaran last year shows that the corruption networks are still alive in this department. I think that every hospital seems to have a racket going on to buy goods from friends at inflated prices. And there's still too many incompetent officials in key positions everywhere. In this situation, as we saw with the billions of rands allocated to combat the COVID-19 epidemic, it's like pouring water in a leaking bucket. Like pouring water in a leaking bucket. It's a leaking bucket. It's a leaking budget as well. That's the problem. It's a leaking budget. It's a leaking bucket. The leaks are everywhere. I'm glad you understand that. I think you do recognize the problem, because the leaks are everywhere. The leaks are everywhere. Everywhere. If it's not stealing, then it's downright incompetence. How else do you explain the feeding frenzy over the PPE money? Or the 500 million rand, probably more, spent on the Anglo-Ashanti ghost hospital in the far West Rand, because that's what it is. It's not even a white elephant anymore. It's just an empty hospital. I don't know what we can repurpose it for. If you spend any more money on it, maybe it's a further waste. The problem with white elephants is you should stop funding them. You just have to write it off. But let's see what happens. And we don't even own this property, as been made clear many times. What about the 200 million rand spent on extra wards at Kopanong Hospital, which are still not completed? Can you believe it? These were supposed to be built in time for the first wave of COVID cases. We're now on the fifth wave, and what they're trying to do is repurpose these extra wards. They're trying to find a purpose for them. They've spent 200 million rand with it, haven't completed it, but now, what can we do with it? And the same for many other projects, including the fiasco in repairing the Shaft and Johannesburg Hospital, which was so badly handled that it has now been handed over to the National Health Department. I know we've been told in this house that it's fully reopened. Well, that's not what I saw yesterday. Maybe it's a different picture today. I've been to that casualty department many times. It used to be very, very busy, people buzzing around. People, you could see that things were happening. Well, yesterday there were hardly any patients there, and it didn't look to me like it was fully open. I hope the situation is different today. But what I can tell you, conversely, is that the crowded conditions at the Helen Joseph Hospital are still utterly deplorable. Here's a complaint sent to me by a visitor who went to drop off food for a patient at this hospital. She says she was physically sick when she left because of what she saw, which she describes as follows, and this is all a quote from the letter she sent me. She said, "There were about 80 to 100 patients lying on the urine-soaked floors. They were begging me for food and blankets. An animal would not be treated this badly. The one lady was screaming as her rapist was sitting 5 steps away from her. People are screaming and begging for help, especially in the psych ward. There is blood, bandages, and a putrid smell everywhere. It is a health hazard itself." One description. I get calls like this every day, sadly. And down the road from this hospital is the Rahima Musa Mother and Child Hospital, where the CEO decided at one stage that she didn't have to be physically at the hospital, but that she could work from home. And, I'm just astounded that she was ever given permission to work from home. But if that's the type of leadership you have at that hospital, then, things are very wrong. And, this week, a pediatrician at this hospital by the name of Dr. Tim Demaio penned an open letter to health department heads. And he asked very pointedly, and now I'm reading exactly from what he wrote, "How do you manage to come to work every day, fail at your job of ensuring basic health care for the people you serve, and still sleep at night?" I hope that the Honourable MEC has read the entire letter, but I will read parts of it. Dr. Demaio concludes, quote, "Having worked in the public sector for 21 years, I can tell you frankly, things are falling apart. If your healthcare workers are the centre of providing care, we cannot hold. Things are going backwards fast. The care that is being provided in your less than glittering hospitals is getting worse every day. Are you worried about the greedy lawyers who are waiting in the wings, suing your department for millions because a premature infant went blind because there was no functional meter, which costs less than 1,000 rand, which should have been monitoring her oxygen delivery? You should be, because money is being wasted on paying negligence lawsuit compensations rather than preventing the problem in the first place. And before you ask, yes, these issues have been raised with management repeatedly, including 2 reports on the critical state of the neonatal wards and obstetric services in 2016 and 2021, and a more recent letter on 11 April 2022 detailing the disastrous state of the hospital. Madam Acting Speaker, what does one say when you read something like that? It's a devastating letter written out of despair by a doctor who is actually risking his job by speaking out in this way. And I can tell you there are many other medical staff who feel the same way. Let me just say up front, I feel very sorry for MEC Mokheti. She was appointed in very difficult circumstances and inherited a severely dysfunctional department. The Honourable MEC is always respectful in answering questions. She responds directly to anything that I send her, and I appreciate this. But nevertheless, Honourable MEC, the buck stops with you. And I request that you respond directly to this open letter written from the heart by a caring health practitioner. And Honourable MEC, I suggest that you start today by acknowledging that there's indeed a health crisis and not merely, quote, pressures, as you have said in a recent interview. You can only start addressing a crisis if you admit that you have a crisis. So, Honourable MEC, admit that we have a crisis, that there are doctors like Dr. Demaio in our hospitals all across this province who have very similar things to say, who watches patients die needlessly. It's just a terrible, terrible situation. Madam MEC, are you prepared to admit that there is a crisis, and if not, why not? Now, I'm referred to all my previous budget speeches, all 28 of them. Go back to Hansard, you'll see. Nothing much has changed over the years. And the Auditor General as well will make his usual devastating comments on maladministration. But let me repeat the prime problem. The money in this budget is being poured into a leaking bucket. It's being poured into a leaking bucket. Madam MEC, your job is to plug these leaks and even change the bucket so that the budget funds a re-engineered health system that delivers quality care for everyone.